All right, good morning, everyone. We have a few folks that have joined the Facebook Live session today, and this video will be out there as well for other folks to watch at a later point. This is our second weekly Q&A session for Facebook Live here on Medicare, and the format is the same as it was, similar to last week, where we're going to go over a brief topic for just a few minutes, and then we'll open it up for a live Q&A session for any Medicare-related questions, just like we did last week. We had a good discussion last week. I thought we had a lot of great questions asked and some good interaction, and hopefully we can do the same today. We'll go up to 30 minutes, so we'll go up to 11 a.m. If we don't have enough questions, we'll end early. Today's session is supposed to be our main topic for today to chat about is really what is covered by Part A of Medicare. Last week we talked about, generally speaking, what is Medicare and who qualifies, and then we had an open Q&A with some great questions. This week, again, we're going to talk about what is covered by Part A of Medicare, and then we'll have an open Q&A as well for any Medicare-related topic. Before we talk about this, though, I want to hit on a couple of quick things. I mentioned in my email blast this week as well that the Medicare Trustees Report was released last week, the 2018 Medicare Trustees Report. This is a report that comes out every year and it's a nonpartisan report. There's a group called the Medicare Trustees that's in the government, and they essentially provide analysis on the status of the Medicare system and how it's performing as far as the expenses that are being paid out versus the revenue being generated via taxes and premiums and such, and really the long-term sustainability of the Medicare system. And over the last few years, the main red flag or alarm in that report is the hospital insurance fund, which is really the Part A coverage with Medicare, and the fact that it's going to, if nothing changes, will be running out of money by the year, at this point, 2026. So last year's report had it at 2029 when they ran the report for 2017. And 2018, it's come in 3 years. And 2026 is the latest projection for when that hospital insurance fund is going to run out of money. So that's a bit concerning, of course. There was a good article that was in Motley Fool, which I put in my Medicare blog and Medicare newsletter that went out this morning. I recommend checking that out. But there were two solutions that were noted from the Medicare Trustees Report, which were highlighted in that article. And the first one has to do with the qualifying age of 65. Social Security pushed out the full retirement age to 67 several years ago, and Medicare still keeps that qualifying age at 65. They haven't made any changes. The projection, or one of the recommendations out there is to potentially push that out to 67, which would definitely help reduce the expense for the Medicare system and help sustain it for the long term. The other suggestion that was put in the Medicare Trustees Report is potentially increasing the payroll tax. Right now, the payroll tax is 2.9% for Medicare. It's 1.45% for the employee and 1.45% for the employer, which makes the 2.9% total. One of the suggestions is to increase that just 0.86%, which would take it to 3.72%, which would be a slight increase for the employee and a slight increase for the employer. Those changes would have significant implications for the Medicare system and help sustain it for the long term. So those are just two suggestions out there that could help have significant financial benefits on the Medicare system, and specifically on Part A, which again, if nothing changes with Part A of Medicare, it would run out of money by the year 2026, which is a short 8 years away. So hopefully there's some action soon. One of the things that did come out of this year's trustees report as well is that in the fiscal year budget for 2020, which gets released around February of next year, there has to be some recommendations in there from the president to help address this problem. So he has a couple of weeks from the time that, or 15 days from the time the fiscal year 2020 budget is released. He has 15 days to basically make some proposals to help sustain the Medicare system for the long term. So hopefully this time next year we've got some suggestions and some draft legislation that's out there to help maintain the system for the long term. So anyway, I just wanted to briefly touch on that today. That was not the scheduled topic, but because the trustees report was released last week, I thought it was important that we touch on that before we talk about what is covered by Part A of Medicare. And again, the format for those of you that have joined, the Q&A, the questions can be asked at any point during the discussion. If you want to just type them into the window in your Facebook Live window, and we'll address those questions at the end of the discussion today. They can be related to what we're talking about today, or they can be any Medicare-related question you have. We can certainly hit on those at the end. Part of the format for these discussions is I do like to kind of start out with a little opportunity to win a gift card. So today's question, our first question for a gift card before we jump into the content, and this was something we touched on last week's session. Other than turning age 65, what is another way to qualify for Medicare? So the first one that answers correctly in the window by typing in an answer to this question correctly will get a $10 gift card either to Starbucks or to Amazon. We had two winners last week for two different questions. Or I should say one winner for each of the two questions that we had last week. And so Beth has put a partially correct answer with disability. you could add some clarification to that, Beth. You may be our winner today. So, or other folks want to chime in on the question here? Under 65 disability. That's still partially correct. Here's Deborah. If they go with that suggestion of increasing the age, okay, we'll touch on the Q&A at the end. Any other answers to other ways to qualify for Medicare other than turning 65? Beth said disability under 65. There's one missing piece to that Beth's answer. How long do you have to be on disability, Beth? There's your hint. All right. All right, Beth. Beth got the answer. So it's you have to be on Social Security disability for 2 years. If you're under age 65, you could be 25 years old. If you're on disability for 2 years, you automatically qualify for Medicare Part A and B. So that's the correct answer, one of the correct answers. The other ways to qualify are end-stage renal disease. So if you're diagnosed with kidney failure, end-stage renal disease, that's one way to qualify for Medicare. And also Lou Gehrig's or ALS is another way to qualify for Medicare. So losing a spouse is not a qualification, Jose, for Medicare. All right, so let's jump into today's topic, which again is what is covered by Part A of Medicare. And Deb, I did see your question. We'll get to your answer towards the end of the session today. So what is covered by Part A of Medicare? So Part A is the hospital benefit. So this table here shows you if you just have original Medicare with Part A and B and you do not have a supplement, this is what is covered by Part A of Medicare, and really what your exposure would be is the pieces that are not covered by Part A. So if you have a inpatient hospital stay up to 60 days, there's a deductible of $1,340. So if you're in the hospital for 1 day or for 60 days, Medicare pays everything other than the $1,340 Part A deductible. If you happen to have a hospital stay more than 60 days, for day 61 through day 90, there's a copay of $335 per day. So Part A of Medicare covers everything except the copay of $335 per day for day 61 through 90. And if you're in for more than 90 days, day 91 and after, that copay goes up to $670 per day. So Medicare Part A covers everything but the $670 per day. All right, and these values change each year. This is the 2018 values in this table for Part A of Medicare. There's also a lifetime reserve of 60 days. So these lifetime reserve days in the hospital, these come into play if you only if you have a hospital stay more than 90 days. So if you never have a hospital stay more than 90 days, you're never going to touch these 60 lifetime reserve days. If you do have a hospital stay more than 90 days, then you'll start to eat into these lifetime reserve days of 60 lifetime reserve days. So there's Medicare supplements out there that would cover all or portions of these costs that are still exposed, which we'll talk about further in a couple of weeks on this session for Medicare supplements. But for now, Part A of Medicare, this is your exposure if you just have Part A of Medicare, and this is what Medicare Part A covers in the hospital. It also covers a skilled nursing facility. So if you get transferred from the hospital into a skilled nursing facility, your first 20 days are fully covered by Medicare Part A. And then after that, Medicare Part A is going to cover all of your expenses for day 21 through day 100, except for the copay, which is $167.50 per day in skilled nursing care. So that's what Part A covers in the skilled nursing. This is not assisted living or long-term care. This is like a rehab facility For instance, if you have a knee operation, knee replacement, hip replacement, you get transferred from the hospital to skilled nursing care. That's where this skilled nursing facility would come into play. So that's also covered under Part A. And then blood work in the hospital. So your first 3 pints are basically not covered. And then after that, additional amounts, but beyond the first 3 pints of blood are covered at 100% by Medicare. Hospice care. So if you are deemed to have a terminal illness, hospice care would also be covered by Part A of Medicare. Deb asked the question is, what about an emergency room visit? If you're in the ER and you have not been admitted to the hospital, that would be covered under Part B of Medicare, which we're going to discuss further next week. That's our topic for next week as far as what is Part B of Medicare cover. But if you're not admitted and you just go to the ER, that is under Part B, not Part A of Medicare. All right, so that is our topic for today. Again, these are very brief topics, just to touch on something quickly here related to Medicare. And next week, we're going to talk about Part B of Medicare and what's covered there. We do have open Q&A session now. So Deb asked a question earlier as well. If they do change that age of increasing the age from 65 to 67 for Medicare eligibility, when will that come into play? So, and these details all still need to be hashed out clearly if they even decide to go down this path. That's one of the hot topics. But my understanding is, in all the proposals I've seen historically for pushing out the qualification age, is it would not impact individuals who are close to that qualifying age. So, for example, the proposals I've seen is for people like 55 and below or 60 and below would be the earliest impacted group. So you'd still have time to prepare, more than 5-10 years out before you get to that 65 age. So on all the proposals I've seen, it would not immediately impact people that are about to be 65 and basically force them to go another 2 years without Medicare. So it would give enough time for people to plan and prepare if they're not going to qualify until age 67. So I hope that answers your question, Deb. It doesn't look like you should be impacted at all based upon your question there. So again, that's the proposals that I've seen thus far. I'm going to leave it open for any other Q&A related to any other questions related to Medicare that are out there. And while we're waiting for those questions, can you speak about how one qualifies for skilled nursing care? Okay, so Beth asked the question here. So related to Part A of Medicare, there's something called, when you go to the hospital, there's different statuses of how they deem the patient in the hospital. When you first get to the hospital, you're in what's called observation status, where the hospital is doing their testing and analyzing your situation, and they have not yet what's called admitted you to the hospital, depending upon your condition. Admitted would be the next status. If you become an inpatient, that's when you would become admitted to the hospital. And there's an issue out there that has affected some Medicare beneficiaries, specifically with Part A of Medicare, where they're in the hospital for, let's call it a day or two in observation status, and whatever the procedure is that they have done for the hospitalization, when they get transferred to the skilled nursing care, if they do not meet Medicare's requirements, which you'll see here on the slide, having been in the hospital for at least 3 days and entered a Medicare-approved facility within 30 days after leaving the hospital. So if they're not in the hospital and admitted, that's another key here that's not listed on the slide. They have to be out of this observation status and be admitted to the hospital for what's called the 2 midnight rule, or 3 days in the hospital, and then they get transferred into skilled nursing care. Then if it's less than the 2 midnight rule, then they're not covered under Part A of Medicare for that skilled nursing care. This is an ongoing issue. There's been some legislation, regulations that were passed in the last couple of years to improve the communication around this issue for folks that are in the hospital. If they're not in for those 3 days or 2 midnights, then there's some communication that's sent to them so they understand the impacts. But all the studies that have been done seem that it's not really improving the problem. for those individuals that don't have those 2 midnights in the hospital. It's just a very confusing topic, as far as this observation status versus admitted to the hospital. Bottom line is, and as part of the Medicare Advisory Board of National Association of Health Underwriters, this is something we're trying to get fixed to help improve so that ideally these individuals would be covered if they're in the hospital for just 2 days and then get transferred into the skilled nursing care. But the current rule right now is they have to have at least the 3 days in the hospital and then be transferred into the skilled nursing care in order to get the coverage for the skilled nursing care. So, all right. Another question from Jose: is it worth getting supplemental insurance if you don't have major health issues? So by supplemental insurance, Jose, there's 2 different types we're going to talk about actually in next week's session. In 2 weeks out. 3 weeks out, on July 2nd, what are the key differences between Medicare supplements and Medicare Advantage plans? We are going to touch on that in a few weeks. But yes, I definitely think it's worth getting either a supplement or an Advantage plan, even if you don't have major health issues. Insurance in general is there for the unknown. If something should happen in the future, you want to make sure that you have coverage. With just Part A and B of Medicare, there's no cap or maximum out-of-pocket expense. So if you don't have any other coverage and you do get sick, for instance, we'll talk about Part B of Medicare, you would pay 20% of your costs, of your outpatient costs, with no cap. So there's no limit to how much you could spend if you just have Part A and B of Medicare. With Part A, as you can see, if you have an extended hospital stay, you're going to pay that $1,340 deductible. Plus, if you happen to have more than 60 days, you're going to pay $335 per day for those days 61 through 90. And for day 91 plus, it's $670 per day if you don't have any other supplement or Medicare Advantage plan. So our recommendation generally is you do want some sort of coverage, either a supplement or Advantage plan, so you're not unlimitedly exposed for your medical services, or hospital services. So, all right. Any other questions out there? We're going to have one more gift card to give away as well. So you can still type your questions in if you have them, but I will jump to the next gift card for today. And we covered this on today's session. How much is the deductible for Part A in 2018? The first one to put the correct answer in the window in Facebook will win the $10 gift card for either Amazon or Starbucks. And I'll get to Liz's question next too. Deb said $1,370 for Part A. That is not correct. So we're still waiting for the correct answer of the Part A deductible. Jose said $134. That is also not correct. That is the Part B premium amount, is the $134. Any other guesses for the Part A deductible? We just went over it. The first 60 days in the hospital, there's a deductible if you just have Part A of Medicare. All right, I'll address some of these other questions out there while we're waiting for the right answer to this one. So Liz's question, the first 3 pints of blood, is that to give for blood testing or receive as a transfusion? That would be to receive. The first 3 pints of blood under Part A would not be covered. So if you're getting like a transfusion in the hospital, after those first 3 pints, then it would be covered 100% for the blood that you're getting. If you have a Medicare supplement, which we'll talk about in a few weeks, that they generally do cover those first 3 pints as well, so you wouldn't even have to worry about those first 3 pints of blood. Let's see here. Deborah continues to guess 1370, 1375. You're close. You're warm, but you're still off a little bit, Deb, there. Beth's question, can you touch on who pays a monthly cost for Part A of Medicare? So for most people, the Part A premium there's no additional premium to pay for Part A of Medicare. As long as you've worked and contributed to the Social Security Medicare tax for 40 quarters, which is essentially 10 years across your lifetime, or your spouse has worked and contributed to Social Security and Medicare for those 40 quarters, then you do not pay an additional premium for Medicare Part A when you go on Medicare. However, if you do not have those 40 quarters, it's actually very expensive to buy Part A. This year it's about $422 is the Part A amount for this year for the full premium if you have to pay for the Part A of Medicare. There are partial qualifications. If you have more than 30 quarters but less than 40, you can buy into Part A for a reduced amount. You're not paying the full $422. But to get the Part A for free, you need the minimum of the 40 quarters contributing to Medicare, and that way you do not have the Part A premium to pay at 65. Claudia Citarella guessed the correct answer for the Part A deductible, the $1,340. So if you have a hospital stay and you do not have any supplement or advantage plan, you just have Part A of Medicare, you would have to pay that deductible of $1,340 for those first 60 days in the hospital. So Claudia gets the gift card today. Beth and Claudia were our two winners. Beth for the question earlier about how you qualify for Medicare other than turning 65, and Claudia for the Part A deductible. So we'll be in touch with each of you to figure out which card you want, whether Starbucks or Amazon, and then we'll email that over to you so you can use that gift card. All right. Any other questions for today's session? I'll give it 2 more minutes here. We'll wrap up at 11, so I'll see if anybody else has any other questions. And actually, while we're waiting, I'm going to try and share. Last week, the question asked on our website is how do you find some more information about the workshops and things. We do have other, obviously we have this weekly session every Monday at 10:30 to talk live on Medicare. We have videos on YouTube, so you can subscribe to our channel. I'll show you on our website where you can click that link to do that. We have about 15 videos out there, and that's continuing to grow for our YouTube videos. On our website, we have our workshop video, which is about 90 minutes. That's the full workshop that we do on Medicare. We have our free Part D analysis form, blog articles that we do monthly or sometimes more frequently. If you want a quote, you can get quotes on our website as well for Medicare plans. And so these are other resources that are available to you.